So we've got a question adapted from a recall from the July 2024 paper A sitting. This question's asking, which of the following best describes the primary mechanism of action of gabapentin? So it's worth thinking about the indication for gabapentin, or the licenses rather. So this is used as an anticonvulsant and a neuropathic pain agent. And again, that's relative to think about the receptor activity. All right, so does it work through potentiation of GABA-A receptor activity? Does it work by binding to the alpha-2 delta subunit of presynaptic voltage-gated calcium channels? Does it work by inhibition of GABA reuptake into presynaptic neurons and glial cells? Or does it work by direct agonism of GABA-B receptors? Or blockade of NMDA glutamate receptors? So, I mean, if you didn't have a clue and you were going to hazard a guess, you might well look at the name, right, gabapentin, and query whether it's a GABAergic medicine. And therefore, does it work by binding to the GABA receptors? Which might seem like a reasonable guess. So gabapentin is a gabapentinoid medicine, obviously, as the name would suggest, but it's not a classic GABAergic drug. So while GABAergic drugs that calm the central nervous system are our benzos, our Z drugs, baclofen and barbiturates. But whilst gabapentin is structurally related to GABA, it doesn't bind meaningfully to the GABA-A or GABA-B receptors. It works by binding to the alpha-2 delta subunit of the presynaptic voltage-gated calcium channels. Okay, so the correct answer is B. So gabapentin exerts its primary therapeutic effects by binding to the alpha-2 delta subunit of the presynaptic voltage-gated calcium channels. This binding modulates the function of these channels, reducing calcium influx into the presynaptic nerve terminals. The decreased calcium influx subsequently leads to a reduction in the release of various excitatory neurotransmitters. So a reduction in release of the various excitatory neurotransmitters, including glutamate, noradrenaline, and substance P. So back to the point earlier about it being used for neuropathic pain. Here's our rationale. So this mechanism is thought to contribute to gabapentin's anticonvulsant, analgesic, and anxiolytic properties. So you can see there why it's a medicine that is used in the psychiatric setting as well as seen in the psychiatric setting, given the overlap between seizure form activity, pain, psychological presentations. Okay, so option A is incorrect because whilst gabapentin does increase GABA synthesis and release, it doesn't directly potentiate GABA-A receptor activity in the same way that benzos or barbiturates do. Option C, this is also incorrect because whilst tiagabine inhibits GABA reuptake, gabapentin doesn't primarily act by this mechanism. Option D, which is asking about agonism of GABA-B receptors, this is how baclofen works. Option E, asking about blockade of NMDA glutamate receptors, this is how memantine works.